Good afternoon. It's really a pleasure for me to be able to meet with you to give you kind of a um, 101 version of PFAS and when a PFAS is a pesticide at the 18th Annual Pesticides in Chesapeake Bay Conference. So as a little disclaimer, I'd like you to know that I have certainly spoken publicly about my understanding about PFAS toxicity, and I am serving as a plaintiff's witness in a large PFAS case. So first, really what are PFAS? And this goes to the heart of the matter of the definition. And the definition that I believe is valid and that 22 states and the Organization for Economic Cooperation and Development believes is valid, as well as EPA's Office of Research and Development, define PFAS as any molecule that contains at least one fully fluorinated methyl or methylene carbon atom. Now, there are at least 15,000 chemicals which meet this definition. Not all of these are intentionally synthesized. It includes impurities and degradants that occur. Some of the common ones or uses that we know of for PFAS are Teflon, Scotchgard, the aqueous film forming foams, and many unknown. And the reason that they're used so much is they're very useful compounds. They provide resistance to grease, water, and oil. They are surfactants and stain repellents, and they do lead to some fire suppression. Now, some of the problems with them are that they are all persistent in the environment. The carbon-fluorine bond really does not occur naturally, and therefore nature hasn't figured out a way to break it down. They are extremely mobile environmentally, and many of them are bioaccumulative in our bodies as well. Now, we have growing concern about the alternatives. This may be another example of unfortunate substitution. Short chain alternatives have been developed, and they are not very well studied. And the few that have been studied, we see the same effects as we see with the long chain ones, and long chains are defined as, for example, greater than 6 or 8 carbons in a chain. And now we have growing concern about the ultra short chains, especially about trifluoroacetic acid, which is being found everywhere and at very high concentrations. So when we look at PFAS, we can kind of divide them into two major groups. One are the polymers versus the non-polymers. And let me just let you know that there are many polymers, and you have to make polymers from monomers. And then many polymers in their life cycle actually can degrade and release the monomers, or can actually especially when it's a side chain fluorinated polymer. And I think the important thing here is that about 80% of the PFAS, the monomers that are out there in the environment, are coming from polymers. And then the non-polymers are into two basic classes, the perfluoroalkyls, which are the long carbon chains with either a carboxylic acid or a sulfonic acid, for example, or some other end groups, and the polyfluoro, which are things like the fluorotelomers used extensively, for example, in food packaging. And you also have, for example, the ether kinds of compounds as well. So I think what's important to understand is that the polyfluoroalkyl and their precursors can transform to give you, depending upon what the precursors are, into either the long chain or the short chain perfluoroalkyl substances. And some of the polyfluoroalkyls will be the ethers, ultra short chains, and so on. And we know that biological treatments and some chemical oxidants can promote this transformation. So in other words, a precursor is also a PFAS. Now, I mentioned before the ultra short chain PFAS, which are extremely important, and these are the C1 to the C3 perfluoroalkyl chains, things that are used in refrigerants, for example. And also that some of the things that were used to replace the chlorofluoroalkenes that were leading to the ozone hole. And atmospheric oxidation generates the trifluoroacetic acid, or the C2. And there are over 1 million precursors to this TFA. And I think that we're beginning, now that people are starting to look, we're finding it everywhere we look. I think some of the most concerning is we're finding it not only in groundwater and drinking water, but we're finding it in blood as well. And the way that we is being used to remove PFAS from water will not remove the ultra short chains. So where are these PFAS? Where are they used? And if you look just at the circle, you can see that, frankly, they are everywhere. They're in personal care products, they're in food packaging and in food, they're in cleaning products, they're in um, all kinds of things, pots and pans, they're used on clothing. And I had mentioned before, firefighting foam. The largest uses actually are some of the manufacturing uses. For example, the productions of plastic and rubber in the electronic industry, and coatings and paints are some of the major uses. And in many cases, the light blue are the polymers, but as we know, the polymers can break down to give us the monomers as well. So how are we all being exposed? The first thing I want to state is that we can be exposed by ingestion, inhalation, and dermal. All are important. As I said before, the PFAS don't break down, and I think it's important to know that they do pass through our water treatment plants. So industry is the sole source of PFAS. Many of them are put into consumer goods, and I gave you examples of some of those, and that can lead to human exposure. And also used in firefighting, and then some of it, unfortunately, has directly gotten into the environment. The consumer goods and the waste infrastructure also lead to environmental contamination, and this has led to contamination of our drinking water and our food supplies as well. And I should mention that human exposure, these compounds do pass through the placental barrier, and they also are distributed through breast milk as well. So where are we finding it? This is a relatively recent from the Environmental Working Group map of where PFAS have been detected above the proposed limits, which I'll come back to, but were finally promulgated. The limits were promulgated back in April this past year. And what you can see is, frankly, any place where there's a significant population, you have lots of PFAS. In addition, anywhere you have a military site, you find PFAS as well, often from the use of AFFF in firefighting and so on. So they're all over. And the thing I kind of want to point out is just take a look at what's, for example, around the Great Lakes, because I think it's important to realize that these PFAS are getting into our fish. In fact, with an analysis of 500 composite fish samples from around the country, it's something that EPA does every couple of years. This was analyzed for PFAS, and what they found is essentially, I think it was 499 of the 500 fish had elevated PFAS, and the dark brown are ones that had really high concentrations, over 50,000 nanograms per kilogram. And what you can see is our major, kind of some of our major water areas. You know, some of the blank areas where you don't see any is because there was no sampling done in those areas. So we also know that PFAS is present, for example, it's not only our freshwater fish, it's also our seafood, and data, for example, from birth cohorts in the Faroe Islands, where many of the people eat whale meat and they have higher levels, or, for example, people who eat shellfish, and this was data off the coast of Massachusetts a couple of years ago. And what you can see is the more shellfish you eat, the higher your PFDA, which is the C10 perfluorocarboxylic acid. Now, that all deals with ingestion, and I'm not showing you the data showing food packaging as a major source, but I think it's important to realize that while our skin is a pretty decent barrier, it's not a complete barrier. And this is some recent data looking at dermal bioavailability using a human skin model. And what you can see is that the shorter the chain, the PFAS chain, the more rapidly it gets absorbed. So the blue is the C3 or C5, I'm sorry, and then you go to the C6, the C7, and the C8. On one side, you have the carboxylic acids, and the others the sulfonic acid. So this stuff, there is some dermal ability, and when we talk about pesticides, clearly we know that there is an issue about pesticides getting on skin. So also I mentioned that you can be exposed by inhalation. And I think one thing, this is some data coming actually from California kindergartens, as well as, for examples, clothing stores. And what you can see is the fluorotelomere alcohols, which have been a replacement for PFOA and PFOS, which were largely withdrawn from the market. And what you can see is that there can be very high levels, 500 nanograms per cubic meter, for example, in California kindergartens. And for example, again, we know that pesticides are used, for example, in schools and homes as well. So what are we finding in pesticides? One of the things that concerns many of us is that when we're doing measurements of PFAS, say in drinking water or in blood, we're often not measuring all the PFAS. We're measuring just a small subset of that 15,000. The best analytical chemists may now be routinely measuring 25 or 40, and some can actually measure a couple hundred, but no one is measuring them all. So many people are just measuring the total amount of organofluorine and using that as a surrogate for PFAS. And if you look here, you can see that the percent of the active ingredients that have organofluorines on it, in this case, is about, especially the point of this slide is to really show it's increased over the last 10 years. 61% versus all of the active ingredients, 23%. And if you look at PFAS, about a third of the active ingredients are PFAS, and that has increased as well. So some of the PFAS chemicals that are approved in US pesticide products, you have some of your highly fluorinated pesticides, for example, the broflanilide. You've got those that are very highest use, which are PFAS, for example, the trifluralin. Some of them are known water contaminants, such as fipronil and bifenthrin. Then you have some of the fluorinated aromatics, which are also PFAS. And then you have, and this is something that, as we know, and I'll bring it up later, unfortunately, the inert ingredients don't have to be tested in the formulation, but you have things like the tetrafluoroethane, the PTFE, which is a component of a polymer, and so on. And so these are also present. So organofluorine and PFAS approved inert ingredients, this is just a partial list. But I think the important thing, if you kind of go through this list, is that many are PFAS, not all. Some just have a single one fluorine atom or not. They don't have the two fluorines on one carbon. Many of them are used in food. Many of them are approved in the US. And in fact, as we know, often things have been approved in the US that have not been approved in Canada or some of them in the EU. So why are we concerned? And this is just not the most recent data, but it hasn't changed. We all have PFAS in our body. This is data from the NIEHS, the biannual statistically based survey of the US population. But everyone globally has PFAS in their body. It's more than 98% of people in the US. You can measure PFAS, and that level keeps going down. So it's really essentially everyone. I mentioned before that PFOA and PFOS have both been phased out. PFOS in 2002, PFOA in 2013. But again, some are being produced by breakdown of precursors or from some of the polymers. And especially if you look at PFOA, there's a decline from 2008 to 2012, and then it kind of levels off. And if you look at some of the other PFAS, there's really no change at all. And in fact, if we look at the replacement PFAS, those possibly unfortunate substitutions, here, this is data from human breast milk, and you can see PFOS clearly going down. PFOA, not going down dramatically, but a little bit. But look at the short chain PFAS, the PFBA, the PF, for example, HXA, and so on. What you see is they continue to go up. Very little of them present 25 years ago, 24 years ago, and those levels continue to rise. So why are we concerned? Well, I think here's some of the health concerns. It's important to realize that PFAS were first discovered in the 1930s in the invention of Teflon, and their production really began heavily after World War II. Um, Industry actually failed to publish studies showing adverse effects of PFOA in monkeys, in fact, killed all the monkeys. Um, PFAS were first detected in the serum of workers, actually in the late 70s, and that was not reported to EPA. There was evidence from the industry studies that PFOA caused cancer in rodents. And again, by 1998, 3M finally notified EPA that they were finding, and they knew this in 1975, that they found that, in fact, samples from US blood donors, in other words, the general population, had PFAS. And then in 2012, I think one of the most concerning things that came out was that there were reports of impacts on the immune system. Um, DuPont scientists raised some concerns about the health risks of PFAS in an internal document. And then they had concerns at DuPont about birth defects in children born to women. In fact, women were removed from the Teflon production line after this was noted. I think what was important, there was a class action lawsuit that some of you may have heard about that was issued in 2001, and it eventually led to a huge class settlement that led to the very large C8 study, which was basically a study looking at PFAS and PFOA in near West Virginia and Ohio near the DuPont plant. And in 2009, DuPont spun off Chemours, and Chemours started making Gen-X as a PFOA substitute. And then again, more data started coming out about the contamination of the Cape Fear River near where I live with Gen-X. So PFAS don't do just one thing. They are multi-system toxicants. You give me a physiological system, and it's likely there will be evidence that PFAS disrupts it in animal studies, in mechanistic studies, and in human observational studies, the epidemiology. So it's clear that PFAS perturbs the thyroid hormone system, as well as the estrogen and the androgen systems and metabolism. It impacts the kidney, being both nephrotoxic as well as increased risk of kidney cancer and testicular cancer. Impacts on the immune system, both suppression of the immune system as well as an increased autoimmunity, impacts the liver with liver toxicity and an increased much elevation in low density lipoproteins, so cholesterol essentially being of concern, impacts the pancreas, and growing evidence that it has an impact, for example, on neurodevelopment. How this happens is it's a very complicated scheme. In other words, this is not a simple one compound, one mechanism. It activates a family of nuclear receptors called the PPARs, and there are at least 3, if not 4 PPARs, different PPARs found in different tissues, and it activates many of them. PFAS also bind to lots of other receptors, sometimes activating, sometimes inhibiting the androgen receptor, the estrogen receptors, CAR, PXR, FXR. There's data that it may interfere with 10 to 14 different nuclear receptors. It can block fatty acid transport, and it interferes with mitochondria, which are the energy factory of the cell. So there's some key research questions we have. For example, I mentioned before this issue of total organic fluorine. Are we measuring 90% of what's in our sample or 10%? And I think the data from human serum is indicating that in many cases, we're only measuring at most, say, 30% of what's in our samples. And depending upon your drinking water or your food sample, again, the amount of that we're actually measuring of PFAS can be fairly small. How do we get rid of PFAS? And I'll come back to that in a minute. I think we're going to have to start asking compounds about where are the chemicals really needed. Can we find safer alternatives? And then we have to have this whole issue. We don't want any more unfortunate substitution. We need to know our substitutes are safe before we use them. We we, the royal we, I was one of the authors, proposed a few years ago that PFAS should be looked at as a class or at least a number of subclasses. There is no way to test all the PFAS, and the national academies strongly said that an approach that uses subclasses is scientifically justifiable. So how we get rid of PFAS, there's no safe way to currently to dispose of PFAS at scale. You can filter out most of the longer chain PFAS from drinking water, but it doesn't, as I said before, get rid of the ultra short chains. And then the question is, what do you do with the contaminated filters? You put them in a landfill. We all know there are issues that not only volatilization from landfills, but leachate. Many efforts are underway to find safe and destructive technology. Some of this has been achieved on a laboratory scale, but nothing in the field. Given this, it seems to me we really have to turn off the tap, and it was sure nice if the polluter paid the cost. So in November of 2021, Michael Regan, the administrator of EPA, announced EPA's strategic roadmap goals that involved research into the development and innovation to understand the toxicities, both human and ecological effects and interventions. We needed to, and they've begun to restrict, to prevent PFAS from contaminating the environment and people, and then remediate it. And all of EPA's programs office says not just, we mainly hear about water, but not just air, water, land, toxics, research and development have specific actions. So if you look at what's gone on with the risk assessment of PFAS, and this really mainly has to do with drinking water, what you can see is that if you look at over the last 20 plus years, the initial regulatory levels, for example, or guidance levels have continued to drop, and we know now that they've even gone lower. I should mention that both EFSA, the European Food Safety Authority, and the Agency for Toxic Substances and Disease Registry have very similar numbers for what is a weekly intake that should be without adverse effects. And, the conclusion is that in Europe, uptake of just these 4 out of the 15,000 PFAS is above the regulatory or the tolerable weekly intake for much of the European population. And ATSGR came up with something else. These are non-regulatory. EPA, its non-regulatory moves in 2016, set a lifetime health advisory of 70 parts per trillion for PFOA plus PFOS. And in 2022 came up with an interim health advisory, much lower, thousands of times lower, for PFOA at 0.004 parts per trillion and PFOS at 0.02. Our states have moved ahead. So, for example, maximum contaminant levels were set in Maine and Massachusetts for a sum of 6 PFAS, and in Vermont for 5 PFAS. And the critical effects have been developmental, hepatic, and immune. And I think the important thing is the science advances, the regulations keep getting stricter. Just a year ago, the Interagency for Research in Cancer evaluated the carcinogenic activity of PFOA and PFOS, and concluded that PFOA is a carcinogen to humans with sufficient evidence for cancer. They say that PFOS, they didn't feel the data was quite as strong, and they said it's possibly carcinogenic. So I think those were very important findings. A summary of this meeting was published almost a year ago, and we're waiting for the full monograph to come out, hopefully this month or next. But EPA last April announced regulations on 6 PFAS in drinking water. EPA concluded that both PFOA and PFOS are carcinogenic, so there was no safe level, so they set the maximum contaminant level goal at 0. But then based on technology, economics, and sociological concerns, they set the regulatory level at 4 parts per trillion in drinking water. They also set MCLs for PFHXS, which is a C6, PFNA, which is a C9, and GenX, which is an ether, of 10 parts per trillion each. And then they added in information for the C4 PFBs, and they said they used an approach that has been used repeatedly in Superfund, which is a hazard index. And if the hazard index exceeds 1 for a mixture of 2 or more of these compounds, then you also exceed an MCL. So they gave our municipal water suppliers 3 years to do their monitoring, and then they have to notify the public of their levels, and 5 years to implement the solutions to reduce the PFAS less than the MCLs. I should let you know that also in April, PFOA and PFOS have been designated as hazardous under Superfund, and the polluter will have to pay to remediate those sites. But there are some other federal regulations on PFAS. The FDA removed all PFAS from food packaging. 2024, DOD no longer required PFAS in your air film forming foam in practice and training, and has to be totally removed now. And the FAA no longer required PFAS in AFFF in domestic airports after 2021. So there is some movement. So what has come up for this? The National Academies sponsored a consensus workshop to look at the clinical follow-up, and basically concluded that there was sufficient evidence that the decreased antibody response, both in adults and children, there's sufficient evidence for really hypercholesterol levels, which is a problem related and is associated with increased risk of heart disease, impacts decrease in infant and fetal growth, and an increased risk of kidney cancer. They felt the evidence wasn't as strong yet, and I should say this report was issued in 2022, and the work for it was actually completed in 2021. There's a lot of data coming out since then, but there was evidence for increase in breast cancer, the liver enzyme alterations, pregnancy-induced hypertension, testicular cancer in men, thyroid disease, and autoimmunity seen as ulcerative colitis. So this finally led to recommendations that led to ATSDR, which is affiliated with CDC, issued clinical guidance last January. And what they said was that if your PFAS is below 2 parts per billion in your blood, in your serum really, you're not expected to have adverse health effects. But if it's between 2 and 20, you should try to reduce your exposure and make sure you get screened for your lipid levels, if you're pregnant, for hypertension and breast cancer. And if it was above 20, then they opine that there's clearly a higher risk of adverse effects. So continue to screen for hyperlipidemia, do thyroid testing, and keep looking for kidney, testicular cancer, and ulcerative colitis. So what's happening in our states? Well, our states are moving ahead. Actually, a bunch of states have MCLs, but they're greater than EPAs, so that they're going to have to now move to EPAs. 30 states have surface water regulations. 23 states look at more than just PFOA and PFOS, and they look at the other 4 that EPA has now promulgated regulations. 36 states have banned or restricted PFAS containing AFFF and food contact materials. Bans are in progress in quite a number of states. Major grocery and restaurants are eliminating PFAS from their packaging. And again, several states have banned it in textiles and furnishings. So the scientific basis for managing PFAS as a chemical class comes from the EU, from their chemical strategy for sustainability, was released in, my goodness, it's 4 years ago now, but they specifically called out PFAS and proposed a ban on all non-essential, unintentional uses of PFAS. So what about pesticide registration? FIFRA, the Federal Insecticide, Fungicide, and Rodenticide Act, requires that registration be re-upped every 15 years. But the Office of Pesticide Protection in EPA, from my opinion, has an over-reliance on industry studies. They will basically ignore studies that are done academically, which I think is a huge problem. They are now focusing extensively on the use of NAMs, which are new approved methodologies, new alternative methodologies. So these are your in vitro, your computer, your in silico models, which I think have a lot of potential and can certainly indicate a problem potentially, but a negative NAM means you may just not have asked the right question. The Food Quality Protection Act of 1996 required a tenfold safety factor be included for children's safety, and OPP recently is ignoring that safety factor, and they are using an outdated definition of PFAS. In fact, they are using the definition that only recognizes about 1,200 to 1,600 PFAS, and it's the industry definition. In the environment, we have pesticides and you have your active ingredient, but the breakdown we know for pesticides sometimes is more toxic and more persistent. So many pesticides are PFAS or they contain PFAS. 14% of all active ingredients are PFAS, and a third of these have been approved in the past 10 years. PFOA and PFOS are found in many pesticide products. They can leach from fluorinated plastic containers, and they can break down from other sources. PFAS pesticides and products, they end up as persistent water pollutants and as food contaminants. I think, again, we need to remember, although most of our testing looks at one PFAS at a time, all PFAS are complex mixtures, and 66 PFAS pesticides are currently approved in Maryland. So this is just a list of the PFAS approved pesticides in Maryland, and I don't expect anyone to memorize or to look at it, but I think it's the heaviest use. For example, fipronil is one of the heaviest use. We know that's a water contaminant. We know that the most reported uses include some such as chlorophenapyr and bifenthrin. Bifenthrin is another well-known water contaminant. So I think this is an issue that really needs to be addressed, and we need to be asking, do we really need these in our environment? So thank you, and I look forward to answering questions.